Hi, this is Piyush Bhargava and I have an interesting case to share with you. We have multiple images from various modalities in a patient with history of cholangiocarcinoma. So we were trying to look for the hypermetabolism in the primary cholangiocarcinoma, which was a very small tumor in the region of the hepatic hilum, which was not seen on this PET scan, but there was another interesting finding. So let's look at the rotating whole body image. The rotating whole body image shows a large focus of intense uptake in the region of the gallbladder. This finding is further localized on this transaxial fused PET-CT image showing intense hypermetabolism involving peripherally the gallbladder wall, also seen here on the coronal image showing gallbladder wall hypermetabolism. There is a MRI image, the coronal T2 weighted image on the top right, showing multiple large gallstones and some gallbladder wall thickening. There was no evidence of acute inflammation on this MRI. Patient underwent a HIDA scan because of the suspicion of acute cholecystitis raised from this whole body FDG PET-CT scan, and we have a delayed post-morphine image on the bottom right from the HIDA scan showing that the liver has excreted the tracer into the small bowel, and there is a small focus of activity which is at the hepatic hilum, and this activity is in the proximal aspect of the cystic duct, and the activity never gets into the rest of the gallbladder, which should be right here when we look at the HIDA scan and also the corresponding MR and the CT from the PET-CT. So this finding of no activity going into the gallbladder is consistent with acute cholecystitis. The hypermetabolism in the gallbladder wall is consistent with that. Presence of large gallstones on the MRI is supportive of that. And this focus of proximal cystic duct activity, or activity that is in the cystic duct distal to the obstruction, is called the Nubbin sign. This is also a finding of acute cholecystitis. So these constellation of findings are consistent with acute cholecystitis as seen on FDG PET and also on a hepatobiliary scan. Here is an interesting article related to the case describing FDG PET in liver and lesions mimicking malignancies. So here under results, the authors say that they also found increased FDG uptake in non-neoplastic lesions such as cryptococcosis, abscesses, and secondary inflammation from cholecystitis. Thank you for watching.